My name is Sejla Murdoch, and I am START's senior psychologist and senior team leader of Neurofeedback Clinic. I've been with START for quite some time. But before I go into that, I just want to, on behalf of our Australian Neurofeedback Institute, acknowledge the traditional custodians of this land on which we stand. I would also like to pay my respects to the elders, past and present, and emerging. I want to welcome you to this workshop today that I want to make interactive as much as possible. So I give you an opportunity to ask questions. I will talk for a brief period of time, and then I'll say, okay, now it's time to ask questions. So you don't have to post questions in your comments box. I think it's much easier to ask them in real time. Of course, for those who listen to this later, can ask me questions, send some emails. You all pretty much have my email address, and I'm quite happy to answer some of your questions. So I've been with STARTS since 1998. That's been quite a long time. I work with trauma, and STARTS has introduced neurofeedback therapy, which is form of biofeedback, in 2003, 2004. I joined the program 2007 using neurofeedback, and since around 2008, when we got Stephen Porges coming and providing some workshop for us, we've been using Heart Rate Variability Biofeedback and have provided training since 2010. So this is something that we use constantly in conjunction with different therapies as a baseline to see how the treatment goes, and also to just to gauge different way of working with clients. And I'll talk about it throughout the workshop. So today I will explain what heart rate variability biofeedback really is, the science behind that, the science of the smart heart. I think we learn a lot about the brain and the importance of brain in mental health and health in general, but there's so much about heart-brain communication that we don't know. I will talk about HRV in context of polyvagal theory developed by Dr. Stephen Porges, because this is one theory that really sits quite well with this. I will try to give you practical examples how to use HeartMed program. This is one of the programs that's available. We've been using this program since we started. We tried different programs, but this one is the one that is being the simplest to use and easiest to track clients' progress. And I will talk about how clients can benefit from this modality. And I'll try to share with you examples of my clinical work with clients. I worked a lot with children using HeartMed or HRV biofeedback. I worked with adults. I worked with different cultures and different language groups. So this is something that I will also try to talk about. But when we have our own discussion, I want you to think about how can you use how can you implement this or integrate this modality in the therapeutical work that you already do, or with yourself or with your family, because I would definitely encourage everyone to utilize HRV biofeedback in their lives. So why to use? What's the importance and advantages of HRV biofeedback? Well, it's quite simple. It really gives you that information about psychophysiology that you might not know. So if you want to meditate, and if you want to use mindfulness training, if you want to do relaxation, I find it is very difficult for people who are stuck in that autonomic reactivity, feeling quite stuck in a trauma or in depression or anxiety or whatever issues is going on with them at the time. So being present to those feelings, it's quite uncomfortable. And for them to learn to meditate or to learn to relax, it's going to take a really long time. This is one way in that doesn't require all that effort and can help you really gauge with your autonomic nervous system quite quickly. And it brings that information to clients. So client can actually see the autonomic nervous system in action and understand what's happening. So as a result, it's a great tool for psychoeducation. I've seen clients who relaxed, who kind of embraced whatever is happening with them much more readily and understood what's happening with them much better after using HRV biofeedback. It's great in reducing stress and anxiety, improving sleep. Use it a lot with children who have attentional issues. It's very empowering because it's shifting focus completely from the problem to solution. And with repetition, you can modulate. So it gives that great sense of control that a lot of the clients I've worked with, and I work with quite complex people who've been through torture and trauma experiences, so for them to feel that control over what's going on with their body, it's a really great achievement in itself. And again, it's fun. So there's quite a lot of games, a lot of things you can do to tailor it to your client needs. And there's a lot of programs out there, apart from the Heart Method, also quite a lot of, great with graphics, quite engaging. So smart heart, so what do we know about heart? What we know is that a lot of times when people feel unwell or they feel emotional, they talk about their heart. So for humans in all cultures, heart is being seat of, love, of acceptance, of they will talk about feeling empty-hearted, broken-hearted, and as such, it's being something that all cultures are very familiar with, and everyone's been talking about. So when people talk about the way they feel, they don't really point at their brain; they point at their chest. They talk about love, they talk about pain, and often they hold on to their chest. What we know is that heart neural circuitry enables it to learn, remember, and make functional decisions relative to heart's activity, and definitely independent of the cranial brain. What we know, it's also that functions as a sensory organ, and is particularly sensitive and responsive to changes in a number of other bodily systems. For example, heart rhythm patterns are continuous and rapidly modulated by changes in activity of our autonomic nervous system, or either sympathetic or parasympathetic. And its extensive internal networks of sensory neurons also enables it to detect and respond to variations, hormonal rhythms and patterns. So there's so much that our heart does. What we know is that it also is a hormonal gland, produces and releases atrial natriuretic factor, which is ANF, and I can't really pronounce this properly. And this hormone widely affects blood vessels, kidneys, adrenal glands, and large number of regulatory regions in the brain. So it's extremely important. What we know, which I already mentioned, but we also know that it's recently been discovered that heart secretes oxytocin, and most of us are familiar what oxytocin's role is in bonding, particularly during childbirth. So concentration of oxytocin produced in the heart are as high as those found in the brain. So this is something just to keep in mind as well. So what we also know is that there's this communication between heart and the brain, often is being just considered as a pump. But really what we know is that there's a lot of information that goes from the heart to the brain. In fact, much more than goes from the brain to the heart. So this dialogue and this communication is dynamic and ongoing, and influences a range of other bodily functions. And there's still a lot of science that talks about the heart, and a lot of things that we're still discovering. So we know that the four-way communication, which is neurological, through transmission of the impulses, of nerve impulses, biochemical, through hormones and neurotransmitters, biophysical, which is through pressure waves, and also energy through electromagnetic field interactions. And there's a lot of research now on heart magnetic fields, and I'll talk to you about some of that, but you can definitely access a lot of that information through HeartMath website, and they have lovely clips available, one of which I have attached here, and talks about basically, the heart electrical field. I don't know if you're familiar with Takotsubo, which is the broken heart syndrome, which is also a stress-induced cardiomyopathy. And a lot of times it happens, there's more women that suffer than men, and the symptoms are of intense chest pain that often happens when there's a surge of stress hormones flooding the body because of some emotional event that's either tragic or sometimes can even be quite good shock, I would say. And it's often misdiagnosed as a heart attack because of the symptoms, and test results are quite similar. But there's dramatic changes in the rhythm and the blood substances that are typical of the heart attack that don't exist in this syndrome. So there's no evidence of blocked heart and arteries in broken heart syndrome, but definitely there's an impact on the heart, which again tells you how amazing heart is and how much of emotion is stored in this particular organ. The other thing is, figuratively speaking, the other thing is there's a lot of studies on heart transplant patients and people who have changed quite considerably after the heart transplant. And in fact, there's Edinburgh Research Centre that does quite a lot of research on this, and you can probably go on the internet and find a lot of accounts of people who have changed considerably after heart transplant. And after further investigation, they found out that some of the new traits they have, it's the traits that were quite similar to the traits of heart donor. So there's quite a lot of interesting information there. And there's another little YouTube link for you to look at when you have a time with this one. Now, what's heart rate variability? We know that heart is not a metronome, so it doesn't beat in a unique, rhythm like a clock. The heart basically beats or faster or slower, and there's a difference and variability between each of those heartbeats. And this reflects HRV or heart rate variability. As you can see on this slide, that between each heartbeat is actually different number or different time measure on interval between the beats, as well as the amplitude of the wave. And of course, we know that heart rate variability is often measured by electrocardiogram. If you go to see a doctor, that's what they're going to use. But this is the sensor that you see at the bottom, which is what we're going to use in our heart rate variability training. So how do we then impact, what does this mean if, we can see this heart rate variability? What we know about it is that can be modulated, but it is modulated by two main distinct and interacting influences, which is autonomic nervous system balance between sympathetic and parasympathetic branches, as well as respiratory sinus arrhythmia and baroreceptor reflex regulation, which modulates this autonomic nervous system influences on vascular tone. And I will go through this as we going to unpack this a little bit more. We know that both sympathetic and parasympathetic branches of autonomic nervous system are involved in the regulation of heart rate. What we know that with each breath, sympathetic nervous system engages in activating or increasing heart rate, and with parasympathetic nervous system without breath decreasing the heart rate. So this control of the autonomic output involves several interconnected areas of central nervous system, which form the autonomic network. In addition to this control, arterial baroreceptor reflex, as well as respiration, are known to induce quick changes in the heart rate. So all of this is connected. Now, the science involved in understanding this, it can be quite complex because there's a lot of information. The heart, heart is complex. There's a lot of messages and brain centers involved in sending. So it really depends on how interested you're in this side of HRV, or if this is important to you or not. You can get as involved, or and you don't have to. So it really is up to you how much you want to read about this. But we know that both sympathetic as well as parasympathetic activity are influenced by baroreceptor stimulation through the specific baroreflex arc, which is indicated in this little drawing you can see. So what we know is that the main clinical scenarios where HRV has been found valuable include the risks in terms of cardiac death, and as well as myocardial infarctions, or anything that's related to anything that's wrong with the heart, or the way you can see it in HRV. So it's a really great tool in diagnosing those conditions. It's also the best early warning sign for diabetic cardiovascular and atomic neuropathy. So it's a great tool to assist us in looking at conditions such as that and preventing, or maybe stepping in and stopping, disease to actually get worse. And it's found 5 to 10 years, the decreases. So it's like really important tool. We also know that, there's a lot of studies that relate to HRV and cardiovascular disease, renal failure, HRV in physical exercises and peak performance. And there's another reason why people use HRV. So a lot of athletes in their work use HRV, or sports coaches use HRV. This is how we came about it. In fact, the first training on heart rate variability came through the pain clinic and people who work in managing pain. So there's a lot of different areas where HRV can be quite useful. I'm going to talk about working with clients who have mental health issues, emotional difficulties, but of course, this also involves people who have psychosomatic issues. I work with people who have fibromyalgia, and also similar things. But we also know there's a difference in age and gender, as well as ethnicity, in terms of heart rate variability, people smoking, drinking, taking drugs, as well as sleep and sleep apnea will impact on HRV. So HRV is really great in looking into quite a lot of issues. And I know that a lot of times I will get a client who will come and they sat maybe in the waiting area and they came to see me, they know me, we worked quite some time, and we start HRV. I can see that their heart rate is quite high, even in resting state, that often is an indication that they might need to go and see their doctor to see, check their heart health. And I think it really helped quite a lot of clients look after themselves much better. So there's another reason why HRV is really important. But when we talk about variability, you can see that with low heart rate variability, there's no difference, that much variability between each beat. But when you see with high heart rate variability, you see that there's a difference with 0.93 seconds, 0.98, 1.2. And that, like anything else in life, tells us about flexibility of the nervous system to cope and deal with demands of the life, because we know that we need to modulate arousal and modulate our bodies to the demands of the environment. So more flexible nervous system that also has that better recovery after stress is the one that's going to do the best. And again, be the healthiest and manage to deal with stresses much better and have much more joyful life. So that in itself is quite important, I think, analogy. So in terms of the overview for HRV in therapy, we know that you need to have optimal level of HRV within the organism, so that sort of flexibility between the beats and the way that heart that works to be able to self-regulate, which I already mentioned. Too much instability, arrhythmia, certain conditions, health issues, medications. So that chaos in the nervous system is very destabilizing, and it can impact on all sorts of other things. We know that with age, HRV declines, so we know that that's the fact after many studies and research. But we also know that people who exercise, look after themselves, meditate, they have much better HRV. So there's more variability in it. We know that, people who reduce HRV, they're greater risk for death post myocardial infarctions than other risk factors. We know that, HRV is being strongest independent predictor of progression of coronary atherosclerosis. And also know that, it also shows that if there's a low HRV, there's also measures, indicates inflammation in subjects with no apparent heart disease. So there are all these conditions that tell us that where HRV is low, we know that there's a problem, actual health-related issue or dysfunction related to anxiety, depression, asthma and stuff like that. So this is being studied and observed quite a lot. And at the end of the PowerPoint, the slides you're going to get, there is a list of literature articles which are available for you to read if you want to understand the role of HRV training in a particular condition. I know it's been used quite a lot with women, postnatal women, dealing with postnatal depression, dealing with grief and loss issues. We use it with clients who've been through traumatic experiences, post-traumatic stress, but also quite complex and chronic grief, which is more often what I would think we see with our clients. So it really is a great tool to use with many different conditions, the reasons. As I mentioned, you can use it with the sport. We know people who want to get better, get fitter, people who want to learn how to meditate but find it difficult, and people who have health-related issues, pain management, etc. So how do we impact this HRV? So what's the way that we can affect it, change it, modulate it? We know that breathing is the key. Modulation of this heart rhythm is due to respiratory activity, which is called respiratory sinus arrhythmia. So these peaks and troughs, these waves are called respiratory sinus arrhythmia. So the in-breath causes the heart rate to speed up and increases the blood pressure. And then, of course, decreases, but then you have the out-breath, which causes heart rate to slow down. And that, as you can see in this waveform, it's called respiratory sinus arrhythmia. What we know in terms of baroreceptor reflex, that's body's way of regulating the changes in blood pressure accompanied by each heartbeat. For example, we know that to prevent the high blood pressure associated with pulse from damaging blood vessels, they expand or dilate to lower the blood pressure. Conversely, between each pulse, the blood vessels contract to maintain blood pressure at sufficient high level to ensure the blood flow. And you can see the picture at the bottom related to a different vasoconstriction and dilation. These changes are mediated by special sensors. And I did mention baroreceptors that control this. So this is another way of understanding this, how it works and what's involved with HRV. Now, we talked a bit about autonomic nervous system. We know that that's divided into branches, sympathetic and parasympathetic. And you can see on the graph on the right is that tells you what each of these branches innervates and the connection with the nerves and the brain. What we know is that sympathetic system mediates physiological activation, immune system activation, fight and flight response. We also know that people, and there's more and more talk these days about it, who have a lot of stress in their life or trauma have quite a lot of immune issues, which again tells you something about, the work of SNS. In terms of parasympathetic nervous system, we know that it mediates physiological and behavioral inhibition or inaction. It's rest and digest response. So these systems have dynamic relationship. I know that a long time ago we talked about, when sympathetic engages, kind of you forget about parasympathetic, but in fact they always work in synergy. And this is really important to understand because HRV is not the same, training is not the same as relaxation. It's got different, it's similar, but it's different in itself because with HRV, what we're trying to do is to achieve the balance between engagement of sympathetic and parasympathetic nervous system with a little bit more of parasympathetic, but not as much as you would want to engage when you do relaxation, let's say. So we know that, for example, with parasympathetic nervous system, it helps with rest and digest. It helps with, that's why it's very important for us to be relaxed when we eat, in a sense, and have time to digest our food after eating. And we know that if we are quite stressed out, a lot of people have problems with IBS because sympathetic nervous system works on switching off that function of digestive tract, because when we engage in flight and fight response, we don't need to use our digestive tract so much. So really, there's quite a lot of systems that put on halt when we engage in that. That's why with irritable bowel syndrome, you have people have that, stop and start thing when their body cannot regulate, and they have a lot of problem with their digestion, with IBS symptoms and similar. Okay. So this is again talking about the balance of the two. So in terms of the HRV, the whole point is for us to see how we can balance the works of our nervous system. We know that in terms of parasympathetic nervous system, this branch slows the heart rate to approximately 70 beats per minute. But we also know that sympathetic branch activates it to from 90 to 120. I will give you some norms to help you gauge different, again, heart beats in resting state. But we know that people who are athletes, their heartbeats can be much lower than 70 beats per minute. So you will see something like 50 or 60, even depends on how fit they are. Now, I did mention Stephen Porges, and we still in contact with Stephen, and we work using as well Safe and Sound protocol that Stephen developed. What we know that he talks about in his polyvagal theory, it's about autonomic nervous system hierarchy. He talks about neuroception and co-regulation, the importance of that. So I just want to emphasize these 3 points. So we know that Stephen talked about that our autonomic nervous system responds to sensation in the body and signals from the environment. We know that he talked about the role of vagus nerve. He talked about the dorsal and ventral vagal. When he talked about dorsal vagal nerve, he talked about the nerve that is more primitive, and he talked about the role of immobilization, as well as the vagal nerve, which is more about social engagement and connection. So instead of talking about just, sympathetic and parasympathetic nervous system in relations to fight, relaxation and rest and digest, fight and flight, he introduced a theory of social engagement and connection. And he says that we as mammals have evolved to use and basically attune with other people first, to use that social engagement system before we start going through the hierarchy of, sympathetic, parasympathetic nervous system. I think neuroception is the concept I really like. And it describes the ways that our autonomic system responds to cues of safety, danger, life threat from within our bodies, as well as the environment and connection to others. It's different perception and it's sort of detection without awareness. We all know that we have went into a room and felt that something happened there, and we don't know what, but we just felt like something happened. We know that sometimes we sit next to people and you might feel a particular way. And so it's like something that we know that happens without conscious thought. And this is the concept of neuroception. Co-regulation is very important. And he says that as mammals, it's a biological imperative. It is absolutely essential to sustain life. So this reciprocal sort of connection, it helps us to move out of those autonomic states into a more connected, trusting relationships. We know that we have to. I know Van der Kolk talked a lot about this, and I love things that he says. He mentioned that we move through the world turning towards, backing away, sometimes connecting, other times isolating. And all of that is guided by our autonomic nervous system. If we have supportive system of co-regulating relationships, we can become resilient. So this is one way that HRV can also be used. And you might, I'm not going to spend a lot of time talking about it today, but it's often used in marital therapy. So they would have partners using HRV at the same time. I have used HRV with children and parents at the same time. I have sort of either had them hooked both using it, or I had one coaching the other, often child coaching a parent. And it was extremely effective. So there's a different ways which we can use this as well. But I just want to mention these 3 points, which I think are very important. Again, we know that when we talk of polyvagal theory, I'm just going to mention that this hierarchy is important. And there's a little YouTube clip as well for you to look at that's going to help you understand what Porges is talking about. Again, to go through it quite quickly, is Porges mentioned that there are the 3 systems, in fact, of autonomic nervous system response. First one is related to a parasympathetic activation with vagal nerve, which is ventral vagal, myelinated vagal nerve, which in turn help us socially engage, relate to others. So that's the first thing the child tries to do, is to engage with the caregiver, to kind of look into their face, to smile, to gauge if they can get some response from them. If that doesn't work, we progress to using sympathetic nervous system, where we engage into cascade of events, but one of it which is either fleeing or fighting. So we cannot fight if you're a child, or if something is going on, it's quite emotional, and there's no real threat, or there's a threat but that's different to actual threat of somebody attacking you, you'll be stuck in this reactivity that's going to basically spiral into to the primitive parasympathetic system branch, which is unmyelinated vagal nerve, that it's more about tonicking mobility or freeze response. And we've seen quite a lot of clients who come to us who are in dissociative states, who cannot engage, who cannot look at you while you work with them, who find very difficult to basically have any social interaction with people. And it's quite common with people who have been through traumatic experience or developmental trauma, or any really diverse experiences in life. So the key factor is this cooperation. And I think that maybe one relevant point in this is that that we know that during mother-child interactions, as well as interactions among individuals with close bonds, there's this unconscious synchronization of heart rate patterns. We also know that because we do EEGs at starts, and we read quite a lot about that, brain activity regulates with heart activity between mom and a child. And also this applies to the pitch of the voice and speaking rate, and hence the use of the Safe and Sound protocol and different other means of working with the voice and music. Even in the utero, fetus senses vibratory and hearing, and translates these patterns into developing brain. So this we know that in different cultures, mothers rock their babies in the same frequency, and this frequency, and there's a study that you can look at the references, you can read more about this, is 70 and 280 beats per minute, which is really, again, as I mentioned earlier, parasympathetic engaged heart, resting heart rate. So this frequency is soothing, and it seems to be similar in many different rituals observed through the history and different cultures. We know that all of this is really important, and it will give us a sense of how to work with our clients, understanding more about science related to why HRV is important, what does this all make sense, and how does it all tie together with therapies and treatments that we use with our clients. I mentioned earlier that if we are stuck in that autonomic reactivity, and I often explain it to my clients, it's like if you're driving a car and you're trying to, if you use a clutch, gears to change gears, then you cannot drive really fast if you're stuck in second gear. And it doesn't matter how much you press accelerator, it's just engine is gonna rev, you're not gonna move anyway. Or indeed, if you never used a gear shift, you can, if you put your feet on the brake and accelerator at the same time, you're not going to move far. So this is basically what happens with people who have this undischarged traumatic stress, who are struggling to regulate their nervous system. And I need to emphasize this, and I'm pretty sure you all know this, that this is not something that's within the conscious control. When your autonomic nervous system is hijacked, it's very hard to rationalize with it. And that's why maybe for a lot of our clients, initially cognitive behavioral therapy might not work so well, because it's very hard to get this stuck person in to move their gears by just trying to talk to their prefrontal cortex when the amygdala is in fact engaged. So it's really important to think. That's why we decided that we need to go a different way about working with our clients and look how we get these clients move from this autonomic reactivity to getting stuck on and stuck off, between flat affect to this hyperactivity or scattered responses all the time, or hypervigilance, feeling constantly tense and on guard, to kind of completely dissociated, low blood pressure and all sorts of other digestive issues. How do we help their bodies regulate? And HRV has been a really great tool that helps this. Again, this is us talking about what happens when we are stuck in that sympathetic hypervigilant as well as tonic immobility or parasympathetic dissociative states. We know that each of these have a range of bodily functions associated with them. We know that with sympathetic, we have increased breathing rate, volume, deep breaths. We have a lot of blood pressure, which constricts blood vessels. There's a lot of arousal and negative affect. There's a lot of eye movement, which we see when we do our EEG scans. People are sweating, they have cold skin, dry mouth, again, symptoms of IBS. So there's a lot of these symptoms. In terms of the tonic immobility, we see the faster than resting heart rate. So we see vasoconstrictions with hypertension. We see, people who are they're inhibiting their aggression defenses, they're dizzy, lightheaded, they blur vision. So this is a range of symptoms you can actually see. With the dissociative parasympathetic, we see slow breathing, slow heart rate, low blood pressure. We see people who have low arousal, they numb. They have elevated pain tolerance. So a lot of people who self-harm have this sort of picture, loss of muscle tone, and also reduced sensory perception. Again, these are some positive symptoms as well as negative symptoms related to that. What we need to know is that there are a lot of things we can look at in order to help our clients and raise awareness to what's going on in their bodies. Later on, when they're ready, psychoeducation is a great tool to free people from, feeling trapped within body, feeling prisoner of their own responses. And HRV can really, really help you to get on that path with your client. Now, this is basically just one slide showing attunement. Again, when you see heart patterns attuning, women who have feelings of appreciation for each other, we see husbands and wives sleeping heart rate pattern co-regulating, very similar. So again, importance of social interaction engagement is a key in this. This is a tool which you can use yourselves in your life, but definitely I will encourage you to use it with your clients. I think I'm going to pause here and allow people to perhaps ask questions. So I just have to figure out how to do this. Does anyone want to ask any questions? Can you please let me know? I can, Rosario, do I need to unmute people or how do I do this? Okay. I can see people posting things in chat. That's Rosario. Should I just continue if there's no questions? So maybe I just don't know what to press. Okay. So I assume that there's no questions. Yes, I was told that you can post your questions now in Q&A. There's Q&A. Barry, all good for Barry. So is there anyone else who wants to ask a question or shall we just continue? Okay, let's go. Now, if there's anything that you think, this is a bit confusing, let me sort of, I don't know if I understood this quite well, you can let me know and I'll try to, some people are saying they joined a bit late, some technical issues. Don't worry about that. The thing is, this is going to be recorded, so you can actually go back to the section that you didn't have opportunity to listen to it again. Okay. So what we're going to do is now to talk about when to use HRV. And I'll take you through different breathing exercises and I'll show you the EMA Pro, which we have available on our website for purchase. I think it's quite cheap considering that the price initially was 400 something or 390. Now it's $400, $435. So we're going to have this available for purchase if you're interested. And it's very good tool and comes with quite a lot of resources for you to look at. Okay, so in terms of how we start to use HRV, We first need to gauge the baseline of stress to shed more light on the issues that they're going through, to raise awareness for clients about what this is, to explain the process, what to expect. And also, another thing is to, during therapy, to help people stay present, grounded, to use objective measures, and for post-therapy to feel calm and relaxed, to track changes and do homework. This is one tool which can be quite inexpensive, because there are some apps which I will send to you the document of, but you can search it yourselves, that talks about different apps you can use on your phone. If you have a smartphone, and most people do, it's downloading the app on your phone and using the camera as a sensor that basically tracks your HRV. It's not obviously as sophisticated as having the actual device. I got one which is for the phone, and you can check that on the internet. It's available through Macquarie Institute. So you can use that when you're on a train, on a bus, or if you are waiting somewhere and you're anxious about things. This is a great tool to utilize for yourselves. But it's a great tool because you can give it to your clients. They can take it home, they can practice, they can engage their families, they can talk about them, with their kids. And it's something that I think it's really good to share with as many people as you can. So what we know is that respiratory rate for a healthy adult is 10 to 20 breaths per minute. And resting breathing rate is 12 breaths per minute. We know the optimal breathing rate to increase HRV coherence, it's around, I would say, 5.5 or 5 or 6 breaths per minute. It's got 60, but it's maybe sometimes less than that. But average heart rate in healthy people is 32 beats per minute. So this is just some just statistics, numbers for you to think about. I think the most important thing is when you have a client who comes and if you want to use HRV with them, it's basically to do proper assessment, which engages doing breathing evaluation questionnaire. And I will send you one of these breathing evaluation questionnaires. We need to understand what the breathing rate is like. Is your client breathing through their mouth or their nose? On why? Is it because, for example, I've got sinus infection, so it's very hard for me to breathe through my nose. When they breathe, is their chest moving up and down? Does their abdomen move less than chest? Do their shoulders go up and down when they breathe in and out? Do they breathe paradoxically, which means the other way around? So when we breathe in, basically abdomen and chest goes up, for them goes down. So it's the other way around. Are they breathing interrupted by sighing? And can you actually hear them breathing? Another thing will be also, are they yawning through the whole thing? Excuse me. So I think this is really important to ask all these questions. Another thing to look at is just to look at them. Once you do biofeedback, you become much more keener observer of the body to see what people look like, how they hold themselves, how they sit in a chair, how tense their jaw is. All of that is really important, because it's really a problematic if you start this and you don't understand what the breathing rate is. Most clients will say to you, if you ask them, how they breathe, is, well, I breathe because, that's what you do to live. So there is this sort of assumption that it's just given. But we know now that how breathing is connected to the blood pressure, to HRV, and it's one way of affecting your HRV. So it's really important to give them enough education, understanding around the importance of breath and breathing, and how we can learn to breathe in dysfunctional patterns for years and years and years, in particularly for people who have been through stressful times. For them, their breathing patterns are very dysfunctional, but not aware of that because they think that this is how you breathe. They don't question that. This is a questionnaire which is, I can never pronounce this one, Nijmegen. It's actually Dutch, but I don't think I can say it right. This questionnaire I will attach to the PDF file, so you'll have it as well, and you can use it. It uses the scale from 0 to 4, which I think it really is great because it gives you sort of the grade of it. Again, very important questions to ask will be about the chest pain, feeling tense, blurred vision, dizzy spells. All these things can point out to some particular medical condition that might warrant referral to a doctor. And I think this is really important to make sure, ask clients what medications do they take, have they had a heart condition, all of that, or asthma or similar. So we need to really investigate before we launch into doing any intervention. What their breath is like short, do they feel tightness in their chest? Do they feel bloated in their stomach? Do they have a tingling, which is often is the effect of overbreathing? They're unable to breathe deeply because their breath is always really shallow. They breathe with just upper part of their lungs. Stick fingers on arms, tight feelings around mouth. So all of these palpitation, all of this is really, really important. So I can't emphasize enough the importance of ensuring that you do proper assessment for each person that comes to see you. Of course, I didn't have opportunity to talk to the participants and to see what work you engaged in, but you really need to think about safety. You need to think about educating people. You need to think about doing proper assessment before you engage in any treatment. So you're going to have this available. And this is indicative of hyperventilation syndrome. Again, I think we had definitely experience with some clients that some counselors who have used this HRV tool, and in fact the client hyperventilated in a session. So they use it without doing assessment, without maybe making person more comfortable. The person may looked all right with it, but then, they started hyperventilating because they tried to breathe correctly, and it was really difficult for them. So they started hyperventilating. Consequently, they had anxiety attacks. So again, I can't stress enough importance of doing assessment, talking to the client, and gently engaging them in HRV, which I will take you through in a minute. Now, to be able to demonstrate HRV, we really need to make sure that people sit in correct position. We know the importance of diaphragm in breathing. It's a big muscle dividing organs in the lungs. So we really need to make sure that people sit upright in correct position. A lot of people sit with their legs crossed. This is not probably the best way of sitting because it lifts and pushes the diaphragm up. It makes it harder to breathe deeply or engage your abdominal muscles in breathing. So I think it's important to think about the way they sit, how comfortable they are. Again, if people have gone through traumatic experiences, we need to make sure that they feel safe in the position that they're in. So I will not put people in a recliner chair and recline it down if they not feeling comfortable, I would allow them to adjust how they sit in recliner chair, if that's what you use in your work. Obviously, you will not have people lying down when you do HRV. You can do this at home, of course, when they practice and they do it at home in their own time. But this is, of course, in your counseling or therapy sessions, I would suggest people need to sit firm, sort of feet on the ground, just to have that sort of sense of grounding and, presence, basically. It says here that you can capture the resting state data, which is basically a person that breathes in natural breathing pace without us prompting them to breathe deeply or any particular way. That gives you the baseline of how their breathing is. But I like telling my clients when I'm going to start the session. So it really depends on, how you work and what you need this data for. This is written again for people who might want to evaluate data. I'm not going to spend a lot of time on that because this is more if you are involved in doing research, if you're using these tools for research. But if not, if you're doing this with your clients, things I'll show you will be much more than enough to help you out. If you're interested in research, let us know. We might have a different webinar that can focus a lot on metrics, on program which is called Cubius that we can use to generate those metrics and do even possibly a research. So this is something quite different. This is more clinical. Again, this is the Heart Med program. What you see is the screen telling you, this is when you open the program, this is what you see. I don't know how many of you have purchased the Heart Med EM Wave Pro or EM Wave. I don't know how many of you have it. If you have it, can you please put in the question and answers sort of section that you bought it or that you never used it or you used it, because it's going to also help me gauge level of your understanding. But this is what happens when you open the program. You can see that you can select and create new client. There's a difference in challenge levels. You can select different game option. Thanks, Sam. You can adjust volume and play, as you can see. So these are different game options that are different in length. The visualizers, which you see at the bottom, are the ones which you can play as long as you want. So you can sit for 1 hour and do it, which I would not suggest, but this is not time limited. Again, when you start the session, you can always limit the time, so to make it easier for you when you work with the client. The balloon game, it tells you that it's 10 minutes long. The garden game, it's 3 minutes long. The rainbow game, it's 5 minutes long. So some people have never used it, bought it, but never used it. Some people have had it for a really long time. And if people who had it for a long time want to talk more about it, quite welcome to have your input in this. And there's Coherence Coach, which can help you coaching the client through the exercises. The My Inspiration section, it's related to, putting the slides and pictures that you want to create your own game, I would say. Initially, when you start using this, I would suggest you always go with the easiest option, the shortest game. I know if you work with children, they will always go for something that's appealing to them, like the balloon or the rainbow game, both of which can be quite frustrating if you haven't practiced well, because I find that sometimes people can, find it difficult to get good coherence, and I'll tell you what coherence is in a minute. in HRV, so get good score so you can get balloon going up. But if that doesn't happen, balloon just bobs at the bottom and can be frustrating. With the rainbow game, the rainbow comes and goes back, again can be quite frustrating. So I always opt for either visualizer, which is much more neutral in my mind, or the garden game, which is only 3 minutes. And often people can get at least something going in the garden game. Again, for the first-time users, I would say Code Coherence Coach is great. But I'll show you the actual screen where you can see data. Some clients, some other clients also like looking at that and breathing in and out, creating that respiratory sinus arrhythmia, trying to make the waves of the breath and heart rate much as smooth as they can. So it really is up to you and up to your client. I have done range of different things for different clients in relations to how I apply the HRV. So I like being really flexible, and I really like to see what is the best fit for the client that I work with. The youngest client I worked with was 4 years old. So you can use it with, I would say, any age. Okay, so let's move on. This is the screen you see when you open. This is the, as I would call it, therapist screen, where you can edit preferences. You can put, and I mentioned that you can select the length of the session. If you don't have a watch with you and you kind of get lost in it with the client, because that can happen too, I think it's important to set the time, because people can be fatigued. It's actually quite a lot of effort to change this, because you are exercising your autonomic nervous system. So it can be quite a lot of effort. You want people to feel that they can do well, which means, again, that in terms of the challenge level, you will always set the challenge level to lowest when they start. And I know, and I had a lot of children coming and immediately noticing that, and because a lot of kids like playing games, they will say, I don't think I want challenge level low because I'm so good in games, and they will insist that they have their challenge level moved, which can be really annoying sometimes when they do it, because then they can't get it right and it can be frustrating. So we need to have a way of explaining that everyone starts with challenge low. This is the way the game goes. That's not a fact, because people who have practiced this can start on any level that they feel comfortable with. But really, I would always start every new client to never use this on low level, and also would not progress them quickly through different levels until they have the highest coherence for quite some time, kept within a period of 10 minutes or 5 minutes at least, because again, when they move to another level, it can be frustrating if they move too fast, because each of those levels require a number of different systems to come online. When we're on level low, we can have a lot of intrusive thoughts, and it can still have high coherence. But as we progress, we find that we have to be much more mindful of what we're doing and what's going on in our body, much more in tune and present in the moment. So I would say that each of those levels require a different level of presence. Again, this is how you create the client. You put the name. You can also connect to the cloud, where you can store and keep all the information. I don't do that because we use this with clients. You can mute the sound. Some of the games have sounds that can be frustrating to certain people. I think there's a ways of changing the music and putting your own. But mostly people get used to it, and I have it really softly in the background when we play the games or visualize them. Just going to see how we're going with the time. So this is the screen which we see, but I will now show you the actual program. Now, this is I'll use it myself, so I'll show you the program. This is the sensor. This is the ear sensor that's used in HeartMate HRV. There's also a finger sensor. It's very important that client if they have earrings on, they actually remove them, because if the earrings are still there, if they have small earrings and they hit the clip, they can create a lot of artifact, which you can see in this red lines or no line, which indicates movement. There is a finger sensor which you put on an index finger. I love having both. They are probably $15 each if you want to have both. It's great because it gives you option that there are people who had a lot of ear piercing, and it's very difficult to get signal, or if they have, for some reason you just can't get any signals on the ears. I use alcoholic wipes to wipe the ear, and I then use, of course, alcoholic wipes, just simple alcoholic wipe to wipe the sensor after each use. You have the little clips here which you can attach to the top. Again, you need to explain to the client. I will show this to the client and I'll show it on myself. I'll clean the sensor and then I'll ask them if they want to do it themselves or if they're comfortable for me to do it for them. It's really important to be mindful of the people and how comfortable and uncomfortable they are with the touch. So we need to make sure that people we are doing this for are actually okay for us to touch them, to show this. Finger sensor is not good if your client has very cold hands and poor circulation. That's going to in fact impact on the signal. So I like having two sensors just in case. Again, if you use finger sensor for children, it's hard because they do fidget, as they need to have a finger sensor, put on a table or in their lap with a hand, of course. So I think it's easier to use the e-sensor in many cases because then people can completely forget. It's very gentle. You can't even feel it. So people forget that they have it on. I'm going to I hope I won't make a problem with this, but here we go. I'm going to use the HRV. And I'll hope Rosario, who is listening to this, can tell me if you can see it and hear it. So now the program is just accumulating the data. And you can see this gong. Okay, so these are the sounds, and each coherence ratio produces different sounds. Now I'm talking, so my coherence ratio, that's a low. So low is quite dull. Then we have a medium, which is a bit more high pitch. And then high coherence ratio, which is much higher. You can, of course, turn the sound off if that can, because it can be frustrating for some people. What we see here as well is accumulated score shown here in this way, but there's also power spectrum, which shows you dynamic spectrum of different frequencies ranging from very low, high to very high. So it tells you how autonomic nervous system works and reacts in a sense. And I will go through these ratios and explain to them to you in more detail. Now, here you can see that there's no proper waves because I'm talking. And even though you can see the red line here because I probably moved it. But What you see here is a coherence score, which again I will explain a bit more later. Achievement score is something that HeartMath uses and kids love to, keep their scores, to know where they're at. And here it tells you the session time as well as current HRV. So my current HRV is quite elevated because obviously I just had a coffee and I'm talking fast and I'm breathing well through my nose. So you can see the program in action. Now, I'm just going to stop this for a second, and I'm going to go back to the slides. Okay, so this is again showing to you what you've seen earlier, and I'm going to take you to different metrics. Now, this is also divided hertz to breaths per minute. So breath cycles in HeartMath refers to inhalation and exhalation combined. So 10 breaths per minute is 5 seconds inhalations, 5 seconds in exhalation, which divided comes to 0.10. So I will refer, go back to this again, just so you remember this. This is important bit of information. Now, what you do when you start using the program, you really need to look at the morphology of each of these waves to, understand that more sinusoidal, more sort of that respiratory sinus arrhythmia, more deeper and higher and more kind of wider these waves are, there's more heart rate variability. Again, if you do check the pulse, you can see that there's sort of, difference in terms of the way pulse record is taken to identify abnormal patterns, if you wish. But on the spectrum average here, you can see the way this, you can see that 0.01, which is that 5 seconds in, 5 seconds out, 0.01. So this is basically where you want to see that bell sort of curve to have the peak is at 0.01 to achieve the high sort of HRV with your clients, or if you're training yourself. Again, I don't know if this slide's going to show them. In terms of the checking post session, when you go back to the session, you have to click this button, which just shows you the graph. You can look at the sessions, and they basically listed the other way around. It's counterintuitively because you have the old lessons at the end and new lessons at the beginning. At least for me, it was always, I had to swap them. So this graph shows you where, in terms of coherence, you are. The red indicates the low coherence, the blue, the medium, and the green is high. So we want the most of the green to happen. It's also good in therapy because we can go through with our clients and we can sort of say, remember when you were going through difficult times, and you can see that it was very hard, for example, at a particular time for you to get high heart rate coherence, but look how different it is now because it's ever-changing dynamic. The children I worked with loved having this because I would plot the changes and differences for each session, and they like to look at their progress and challenge level and achievement scores. What also is good is that you can see here that 1 star indicates the lowest level, where you're at and what level you are, and coherence ratio, which 0.8 is probably on lower end because we want to be, the higher end will be around 3. So you really want to go above 1 to have that medium high coherence rates. And here it tells you the average is your heart rate. So this is, again, post-session overview, looking at what happened. You can enter the notes. You can go to the session, enter the notes for each of your clients in the session. You can basically write the, how, there is the date and the time when this was done. So it will tell you when the first session was and the last session was, and each time you click, you can highlight particular session. When you start, of course, important for you not to get worried when you see that your client was unsettled, not in a zone, or, but you can see progression through time. When there's a lot of red, that indicates artifact movement. So it's important to sort of see if the client is moving a lot, if maybe the sensor and the clip, are sort of clicking or not attached properly, or if they're sitting on a chair and there's a pillow and they're hitting their head on it, or if they have a finger sensor, they're tapping their hand. Children like to move their fingers on a sensor just to make it more fun. So there's all sorts of reasons why you can have artifacts. So again, it's very important that you observe your client, that you are quite, keen observer, to look at their body posture, to look at how they sit, what happens when they move, what do you see on the screen at the same time. There's a couple of milliseconds in the sense of the delay in terms of the data, how it's from actual once it's received. So it's something that you might not see instantaneously, but we'll see within a couple of sort of seconds. Again, this screen here is a power spectrum. It's going to tell you about where their clients' HRV is skewed towards low frequencies or very low frequencies in terms of the sympathetic or parasympathetic system engagement. Now, I did promise to talk to you about these frequencies. Now, we know that frequency domains measurements, they quantify time series data using the Fourier transformation to measure the power milliseconds divided by hertz in 4 frequency bands. So there's quite a lot of science to this, and there's quite a lot of metrics. And again, I'm not very good with metrics because this is not something that I will necessarily look at. But the power spectrum is something that I'm extremely curious about, and I will look at, and I will talk and discuss it even with clients after the sessions. Now, in terms of the frequencies, we know that all ultra low frequencies are much lower in terms of their hertz. So they are on much lower end of the spectrum, which will not be recorded in the HRV that we're talking about. This is something that can only be recorded in 24-hour recordings when doctor gives you the HRV device to take home, and then you can record your baseline HRV, but that's very different to what I'm talking about. What we do see on HeartMet is the very low frequency ranges, which are from 0.003, so it's still quite low, to 0.04, which you can see here. Then we see low frequencies, which are 0.4, which are basically, these are very low ones. These are low frequencies that will be readily available for us to see on HRV. And then we can see the higher frequencies, which are 0.15 to 0.40 hertz. So these are from the green color. You can see them in different, displayed in different way. Okay, so very low frequencies power is the one that is correlated with mortality more than low frequencies or high frequencies. High, very low frequency power has been associated with PTSD, impaired immune function, and low testosterone. And it also, low power, low frequency is also associated with increased risk of mortality and morbidity. But again, this is something that we can't measure with the devices that I'm talking about. Lower frequencies, 0.4, 0.15, is something that we see in HeartMate program that I talked to you about. That's, again, the resting conditions, low frequency, primarily reflects baroreflex activity, as well as respiration rates, 8.5 breaths per minute. So we know that sighing or sighing-induced vagally mediated power increase in low frequency bands. So, doing that quite a lot. High frequencies reflect parasympathetic and respiratory sinus arrhythmia activity. Low high frequency power is correlated with stress, panic, anxiety, and worry. And they also give an estimate of vagal tone under control conditions. So to calculate total power, you will use these frequencies and you put them together. And again, these are the equations for absolute power, relative power. Again, this is not something that I would particularly do when I work with client clinically, but still a piece of information if you're interested to do. Again, HeartMate has got, if you're unsure about any of this, HeartMate's got really good explanation about each of these frequencies. So I think it's really good to go there and look at it again. Now, this is again the spectral display of these frequencies, and we can see how the changes in breathing rhythm can, affect these frequencies. Again, there's a link to an article that talks about the frequency ranges, pathologies, as well as HRV and heart health. And I would definitely recommend for people to look into that. So in terms of the treatment session, depending on how you work, you can get the baseline assessment. The EMI Pro offers that function as well. So you can go to EMI Pro and you can do assessment that ranges from 1 minute to 10 minutes or whatever minutes you want. I would say that maybe 5 minutes to 10 minutes will be good, where people can just breathe normally. The 1 minute assessment, it's more related to a person engaging in the deep breathing while we're doing the measure. I would consider that problematic working with trauma because a lot of clients will tend to hyperventilate and get very anxious. So that's not a feature I use, but I have used the resting state measures. Very important thing is to demonstrate diaphragmatic breathing so people can understand there are different types of breathing, as I mentioned earlier, to do that assessment and to demonstrate that. And again, a coherent coach is a great thing to use. A lot of clients would really love that. Some clients might not like that, some might like that. But in coherence coach, there's a pace, there's a feature that shows you how you can basically change the pace. So the beautiful thing about using HeartMate and HRV in HeartMate is that you can tailor the breathing, breathing rate to the client's ability. So we know the optimal is around 6 breaths per minute, or 5, which is 5.5, that's 0.01, peak frequency, which we want to see in the graph of absolute power. But we also know that it's very difficult for people to achieve that initially. So I will definitely recommend that you set the pacer to the client's comfort. And even in that particular, if they breathe faster than that, they can still achieve high coherence or medium coherence, which again will lead their system to want to know more and learn more and regulate more. So we don't want to set them up to fail. We want to go with what their breathing pace is, what they're comfortable with, and we move from there. Once they're more practiced and more ready, we'll move slowly towards that 5 to 5. Again, you can, depending on your client and what they like, you decide to go coherence coach to look at the chart itself, and you can look at the low, medium, and high frequencies, color shifting and moving. You can have the sound off and on. You can use the games. Again, I would strongly emphasize the importance of using the games that are more simple and shorter initial sessions, just to engage client in the process more. The resonant frequency is the optimal frequency for that person, where they can produce the best rhythm, rather, or HRV coherence. So what you want to know is what is their resonant frequency. And I would say it's different depending on the situation where they're at in their life. Again, the breathing rate can be different depending on if the client had coffee or energy drink, if they jogged to come to see you, or if they are distressed, if they're on particular medications, all of that, or drugs. So all of that will impact on that frequency. So it's, kind of, self-modulating, changing and dynamic. So keep that in mind when you work with clients. I like using HRV. Again, I really want to go from where the client is to gauge what's the most comfortable way for them to do this. Sometimes we'll set up to use this, and the client will go into a story talking about the experiences, something that happened, the dream that they had, the trigger that they had, while they still have a sensor on, and the session was still, we will still record this HRV. And we could reflect on that, and I could say, they will smile or laugh. And in that moment, immediately after, you can see that there's really high coherence. And I would point out, but look, as soon as you laughed, your coherence went up, means that, it's like your nervous system has managed to find the balance. And it looks like, laughing is something that gives you that balance and puts you in a state of relaxed, focused attention. So it's, this is really important, again, to emphasize that when you do these HRV clients, it's not about engaging them in complete relaxation, because now that when we are in that relaxed, completely relaxed meditative state, our brain works differently. This HRV practice and practicing can be done in any situation and setting, but a lot of clients who had to have interviews with different departments that produce huge amount of anxiety for them. But once they learn how to modulate their reaction, they were able to stand in the queue and do the breathing and be aware of their breathing and, just feel really that grounding presence even during the interview. Had young kids or teenagers who had a lot of anxiety related to exams or public speaking, and this has really helped them regulate and relax before they did any of that. Again, you can set the homework to client. It's something they take home. I would again approach it differently with different people. If you work with parents and children, you can engage the caregivers and parents to do this together with them. And you can show to the parent in a session, or you can, with adults, use the smartphones, as I talked earlier. You can, none of our clients have resources to purchase these devices, But there are portable ones which were fairly inexpensive. I don't know if they're still available, but you can check. They're not as sophisticated, of course, as the game. But there's lots of different ways in which they can gauge in. Once they know their resonant frequency, how, many seconds breath in and breath out, they can use that in itself to practice at home. So different ways in which we could use this with, gratitude journal, mindfulness exercises and similar. I would not sort of, this is for you just an example how things can be done. Again, this is something that can help you think how you're going to set up your sessions. But on the other, but you can really be as creative as you want. And again, I can't emphasize more enough that I always go from where the client is, what they like or dislike, what they feel comfortable or not. If I work with somebody who's really engaged in that autonomic reactivity, I will really take it gently and take it easy. And I will just offer a few minutes each time when they do this. I'm just going to see how we're traveling with time. Okay. So this is a possible instructions which you can give to your client when they start this, So you can say your heart rate goes up and down with your breath. When you breathe in, it tends to go up. When you breathe out, it tends to go down. And this is possibly, again, something that when people are taught to meditate or relax, emphasis is always on the breath out, to keep the breath out longer. And the reason for it is to engage our parasympathetic system more, to, trigger that relaxation response. So you can talk about, I will not use this in a sense to say, oh, this is called respiratory sinus arrhythmia. Sometimes clients be confused, but there are a lot of clients who might actually like this. I had people who, nurses, I had doctors, people who understood quite a lot about heart and the way it works, but never taught, different way of looking at heart and breathing. So for them, they were really curious about, so you can actually use that as well. So, these are sort of certain things you can say to the client, and I'll attach this as with your progress notes. Now, this is a third HRV biofeedback session, but it doesn't have to be third. It can be any of the session. It can be 20th or 10th or 5th or whatever. But this is, again, talking about resonant breathing. And this here is a power spectrum display, which you will see in the HeartMed program. So we can see all these frequency ranges from 0 to 0.4. So from the lowest to the highest. Again, we're not going to see the ultra low, but we see, for example, this blue one. You see the 0.01, which is that 5 breaths in, 5 breaths out, which is where we want this to be the highest peak. Okay, indicating there's a high heart rate variability and coherence. Coherence is the term that is being coined by HeartMed. It's not something that's used generally in HRV. If you go and read different articles and scientific articles about this, it's basically the ratio that they use to say how much of the parasympathetic sympathetic system engagement we see. And coherence in nature and in life, it's about this, optimizing the balance of all the systems. So in terms of this, when we see the peak closer to the 0, we know there's more sympathetic activity, that there's more shallow breaths, the more fast intakes of air. And when we see this skew to, I don't know if you see my cursor, I hope you do. If you see from point 2 onwards, you can see that there's more of that parasympathetic engagement, but there's longer breath out. So the client is trying to self-regulate, but breathing out much faster, okay, much slower, or longer rather. So coherence is calculated, basically calculation of HRV that captures the percentage of synchronization, organization among physiological and emotional cognitive systems. So as I mentioned earlier, the higher coherence ratio in HeartMath, the more synergy there is between all the systems engaged in autonomic reactivity nervous system. And of course, we know that HRV and coherence decreases with the stress, negative way of thinking and disease, and increases with calm and positive and healthy states. So we know all of that. And as you can see there, that heart rhythm coherence ratios are pointed out. You can see at 0.1, there's a really big peak, which tells you that there's a quite high coherence ratio. So there is this variability between each beat. There's more variability. The nervous system is much more able and flexible to cope with demands of the life, because we know that in life things are stressful. We know that they want that, you know, clients who come with their issues and problems, they will go home and then face new issues and problems. So what we are trying to do with HRV, with the therapies that we do and integrate it with, is to create this resilience, to ensure that there's a flexibility in the autonomic nervous system. They can adjust to the demands of the environment, and that they can use techniques they learn in any situation of stress. In fact, any situation in life that's going to help them deal with, you know, stresses in future. So I hope this makes sense. And again, I'm going to talk about resonance breathing further, and you can see the graphs talking about how with coherence, with high coherence, we have the blood pressure, we have respiratory rhythm, as well as heart rhythm synchronizing. You can see that there is this quite beauty in terms of the way we look at these waves, you know, how much more beautiful they are than the ones on the left that are erratic and, you know, ununiform. And you can see difference in baselines for heart rate variability in terms of PTSD. You can see that's when before training, you can see how erratic. There's no particular peak, but you can see more skew towards the sympathetic engagement. And you see once the person has practiced and then trained that it moves and shifts. And you can see that the same with time, the pulse, as well as respiration. There's this sort of synergy of the way things work in the body. So I quite like this because it really gives you a great way of understanding the importance of HRV in work that we do. And it's said in a way that this is not something that's taught to psychologists or people who do therapies in the university, in the studies, because one, you know, we cannot divide the body and the mind. It's all part of one person. So there are different ways in which we can impact our nervous system, our emotions, and biofeedback is one of those ways. And HRV is definitely the ways in which you can contribute quite a lot of change and bring awareness to what is going on with people. So we know that heart rate and blood pressure are the oscillations synchronize 180 degrees out of phase. So this is again tells you about breath. I did mention 5, but they say 4.5 to 6.5 breaths per minute. So there is a range to it. So let's go and talk about different coherence states and coherence. So we know that in order to achieve coherence and to achieve good flexibility in terms of our nervous system, to react to stressful situations and to bounce back from them, there needs to be this physical flexibility and emotional flexibility, endurance in terms of the strength and physical side of things, as well as emotional, mental endurance, and positive outlook, an ability to self-regulate in a way that is helpful, not utilizing things that are harmful, and seeking others when we need people. We know that that allows for mental flexibility, better attention. It is quite common sense to know that a child at school who is struggling emotionally will struggle educationally in terms of learning. They will have issues with attention, will have difficulties with focusing, and that goes same for adults. So we get a lot of referrals for kids who are diagnosed with all sorts of different learning disorders, like disabilities and similar, ADHD and similar. But in fact, what we know is, what we find out later, is that it's because of the traumatic experience they've been through. It's very hard for their systems to regulate. And maybe there is some issues there in terms of the attention, but it's just exacerbated and made much more difficult when, you have the emotional or trauma-related issues that they deal with. Again, depending on what clients you're working with, some clients, their spirituality is really important, but having that flexibility and ability to accept other points of view, all of it leads to better state of coherence and health, I would say. You tolerate others better, you get less annoyed or frustrated with different opinions and ideas. And you can incorporate the sort of different points of view at the same time. So I just wanted to kind of stress this as a very important point. Again, this slide shows you different coherence states. We have the psychophysiological coherence related to appreciation, and the bottom one is related to anger. On each side, you can see the power spectral display, which tells you, where they're at in terms of their coherence. You can see the respiratory sinus arrhythmia. You can see those lovely waves in appreciation, and you can see that they, there's a peak at 0.1 or close to it in the power display spectrum. And in terms of the anger, we can see that there's quite big skew towards the sympathetic nervous system, arousal, engagement, and we can't see any particular waves. I mean, they're not erratic, and, there's no sinusoidal waves in it at all. So again, this shows the time and this shows the frequency. Left is time, the right is frequencies. So this is something from the HeartMate that talks about psychophysiological coherence. Again, mentioned that it's associated with sustained positive emotion, and it's we know that breaths under 8.5 per minute, around 2.28 hertz or 0.1, around that, you have this lovely coherence showing. In terms of the HeartMate program, coherence is also shown in the green spectrum. And it's also increased, there's increase in parasympathetic activity. So these are the components of the coherence. It's also characterized by a single very large, very low frequency power peak if you have incoherence. So this is another important point that I'm going to show on this. So if you have, again, that sympathetic nervous system, very low frequency, you can see it there. But there's also another thing that you can see, like this one. You can see that quite a lot of spikes more towards the. I'm afraid these graphs are not actually so easy to point it out, but you can see that there is quite a big difference. So if you see that skew, you know that there is erratic and distorted heart rhythm pattern, as well as fast breathing that I already talked about earlier. Again, mental focus. There's not a lot of, respiratory sinus arrhythmias, so you don't see those nice peak and troughs. But at the same token, it's not really erratic. But we see the open focus relaxation. There's more to it. Again, we don't see that 0.01 frequency display in terms of the peak and that point. Okay, so I think I'm going to take a break because I've started to cough, and I'll come back in 2 minutes. I apologize again, but if you have any questions at this particular point, can you please put them on Q&A? And I'll start in a minute as soon as my coughing stops. Thank you. Okay, I think we're going to start. I apologize for this. For those who didn't hear me say this earlier, I've got very badly timed sinus infection. So being sick quite a bit for a week. So Libby has asked a question. It's related to the HeartMath program called the Resilient Heart. I've done... I communicate a lot with HeartMath people, and I've done their certification training for professionals. I think Resilient Heart program is probably quite useful. I don't know how much it is. So if it's quite a lot of money, what I would do if I was in your place, I probably would want to learn much more about the program, use it with my clients more effectively, and then perhaps think about purchasing this. because I think without the program, I've done quite a lot of work with very traumatized children from different cultures. I even had children coaching each other, children who are really, labeled all sorts of names, from ODD to, anything, who had a lot of problems in self-regulating and, fighting all the time, being quite aggressive. And in fact, they coached each other using Heart Rate. So I would want, I first probably want to use the program with kids, see how it works, and then I might want to think of purchasing something else like Resilient Heart. I know they're doing, they have a clinic in which they work with traumatized children. And I was in touch with a person who wanted us to work together and like collecting data, working with children and using Heart Rate. I don't know where they're at this point. In terms of the certification, there's a body called Biofeedback certification body, really, that's based in USA. And they certified people who are using biofeedback HRV. So that's kind of official body for certification. The Heart Rate certification is different. It really certifies you for using their product more than general biofeedback certification. That's going to help you then probably teach other people and be like certified provider biofeedback. Probably in the world. We are thinking of doing the certified course, but the process of getting certified with BCIA, it's quite lengthy. You're going to need to have around 2,000 hours of working with clients. So there's quite a lot involved in getting certification done. But this is something that AMFI is looking into and possibly, hopefully, even having the program which is full two-day training next year. So we are not sure at the moment. But of course, Libby, if you think that this Resilient Heart will help, it's definitely great. In terms of working with children and who experience trauma, there are visualizers that I find really useful when working with them. And, one, it's basically that heart gets all, holding, you holding hand, it's called Healing Hand. And so it's something that I use quite effectively with a lot of children, where they could talk about their own feelings and feelings towards themselves and how others feel for them. So there's a lot of things and components in the program you already have that you can use. But if you don't think that that's enough, I definitely can go ahead and use other things. A while ago, I purchased the program through Heart Rate, and I think that was probably 15 years ago. That program was had group session designed for children, so it can be done in education settings. So I don't know if there are any teachers amongst participants. Some people teach people, but definitely something can be used with children. So this is done without having sensors and without having the software. It's basically talking, psychoeducation about breathing. There's a toy in shape of the heart with hands and teddy bear with heart on its chest that kids can hold. Teaching children how to hold their hands when they think about their breathing. So there's all sorts of things and programs you can use. Another question is by Tim, who's asking about EMA Pro system and inner balance and how their clients can access their point system in the Heart Cloud. Tim, I really don't know, because most of our clients don't actually have access to the system. People don't have can't afford it, so we haven't used the cloud much, but I'm pretty sure information is really easy and available for you too. And I would assume, yes, people will have some sort of access And if you are not sure, you can always go to HeartMate and ask a question. They're very, very good in answering questions like that. I'm sorry I couldn't provide more information in terms of that. So this is, again, practicing measures of the resonant frequency. This is, again, optimal frequency for the client you work with. So it's about trying to understand what's the breathing rate that's the best for them so they can take that back home and practice. If they don't have access to the software, if they don't have access to smartphone, if they do, they can still use it when they have these apps, which a lot of them are mentioned earlier, free. And I will attach again, for those who don't know, didn't hear, I'll attach the document with different apps and how, I guess how good or bad they are in terms of HRV. So again, you can take a screenshot and see how your frequencies were before and after. You can take a screenshot of power spectrum and see what has changed. There's all sorts of things you can actually do with clients and can be quite creative when you work with them. So this is, again, the slide telling you how to look for, what you're looking at. So you can see this respiratory sinus. You can see these lovely smooth waves, which, tell you about, this is, where they're at in terms of their breathing. Point high. Again, on this side, which is right side, it says breathe, and it points out at breath pacer. And this is what I mentioned to you, where you can change and adjust the breathing rate to your client's comfort. Again, this is the ideal one. It's at 10 seconds, 5 in, 5 out, but it's going not to be 10 seconds for people that come to see you. It needs to be manageable. It needs to work for them. It needs to make them feel comfortable. You can try and you can say, let's try to do this. And if they're struggling, then you just adjust this either plus or minus to their comfort level. And they will tell you, you can ask them, and you can also see on the display if, they feel better or not. This is basically the accumulated score that tells you where you're at in relation to the training. Are you in the zone? And as you can see, the zone is white. So there's a and this is what's great about Heart Rate Variability in this program, is that your ratio in terms of coherence can be quite different to somebody else, and you can still be in the zone in terms of the training. So it's not going to be very high coherence, but it's going to be high enough for you to train in the zone and to, get the green light and get that sort of positive feedback that you're doing well. Again, the green, it's high coherence, but again, shows how dynamic that is because colors will change. When you have client on high for a couple of minutes, you know that you need to change the level to a different level. These slides tell you approximately to, help you understand where they are in terms of the frequency. So when you look at just a second to shrink something. You can see the 5 minute, 6 breaths, 5 breaths, 4.5, 5.5, 4. That's where the resonant frequency was found for this particular person, because you can see that this peak is closest to 0.0. And you can see it's much more of a peak. All the other ones have kind of little troughs at the top, so they're quite different. Again, this is a script that can help you take time through the measuring resonant frequency. It's something for you to use or not, something to get you started to go, going to think about what's the best way of doing this. Again, reason and frequency is about effortless breathing. So if there's a lot of effort, if client is struggling, again, change the breathing pacer, find the one that works for them, and then progressively you can challenge them through it. This tells you diaphragmatic breathing, what it consists of, what is important in terms of diaphragmatic breathing, and what you see in terms of exhalation and inhalation rates. I'm not going to go through all of this because I want to. Again, this is a slide that tells you about that it's 8 breaths per minute. There's in terms of the chemistry, what happens. In terms of the hemoglobin releases of oxygen, nitric oxide, there's a higher release, there's a higher vasodilation and higher oxygen glucose perfusion. So you see there's an optimal metabolic function of cells in that particular context. Now I hope I'll be able to take you to a YouTube slide that talks about the okay, for some reason I think I've done something wrong again. Okay, let me try. Okay. So Rosario, you want to let me know if people can see this?
During inspiration, the diaphragm contracts and increases the volume or area of the thoracic cavity. This increase in volume results in a decrease in pressure in the lungs, which causes air to rush from the atmosphere, a higher pressure, into the lungs, a lower pressure. During expiration, the diaphragm returns to a relaxed upward position, reducing the volume or area in the thoracic cavity. Air pressure increases within the lungs at this position, a higher pressure, and forces the air out of the lungs into the atmosphere.
Okay. Oops. Okay. That do you? Let me close this. Now I hope you can see this. So that's a little YouTube video talking about the breathing, diaphragmatic breathing, and the importance of that. I think there's all sorts of resources out there people can actually look at and read, and can be really helpful for them to understand, what the optimal breathing is, why breathing is important, what does it mean in terms of the health, general health, and mental health. So again, this is again telling you about breathing and diaphragmatic breathing, as well as respiratory sinus arrhythmia, how to achieve that. I don't want to spend time on this because you've seen it already, because now we only have 15 minutes and maybe there's some questions at the end. Again, what we need to understand is that the breathing rate is different too. So for example, when people go and see their doctors, often their blood pressures are much higher than normally because of the anxiety about having that particular test. So we need to be mindful of that. That's why I think, it says here that observing clients breathing on the in-waiting area can be problematic because it's probably very difficult to do that. But I think is while we talk to the client, when I engage them in relaxation, just talking about their day, how they are, this is where we can be keen observer and make sure that we understand and, notice particular things. If, when they breathe, do their shoulders go up and down? Do you see that, they sit in a, posture that's quite defensive, which will then restrict their breathing? Are they sighing a lot or yawning? So I'm going to go through some of the things in terms of function and functional dysfunctional breathing patterns. One of the patterns is called thoracic breathing, which is upward and outward movement of the ribs due to the contraction of the external intercostal muscles that produce partial vacuum, but expends excessive energy to completely ventilate the lungs. So there's this, breathing that's not actually optimum. The lungs don't empty completely. The other one is clavicular, which chest rises and collarbone elevates to draw the abdomen up and raise the diaphragm. But over time, the muscles consume more oxygen than they provide. So this is, again, not something that we want to. Reverse breathing, it's also called paradoxical, which abdomen expands during breathing out and constricts breathing in. Overbreathing, when people reduce, excessive breathing, which reduces the tidal carbon dioxide before 5%, which makes it very difficult. People feel they don't have enough oxygen in their brain because they're breathing so much. And then hyperventilation, which is rapid breathing and breathlessness, which reduces that CO2 below 5%, exceeding the body's need to eliminate CO2. We know that molecules of oxygen are much bigger than carbon dioxide, so there will be a lot of oxygen, but not of the carbon dioxide sort of balance that can make people sort of fainty as well as feeling that they don't have air, but there's actually quite a lot of air. Apnea, we get a lot of clients who have sleep apnea or silent one that they're not aware of, that can impact on their health, on their ability to achieve good HRV, and also, on general ability to focus and attend to things. And this can also happen with children, so just be mindful of that. Again, if they have sinus issues, problems and stuff, that will also impact on their ability to breathe. So, of course, you will not want to do some exercises with people who are constricted, because it will be hard for them to breathe properly. Again, this is example of thoracic clavicular breathing, which you can see in the in the display in HeartMath. We have reverse breathing, which you can see it's also visible in a way in this slide. I would not necessarily expect from you to understand all these different patterns, but it will be great if you could observe them and assess them before you actually do assessment. So you might not understand them when you see them in charts initially, and might not be even that relevant, but you observing the client and the way they breathe can lead you to the same conclusions. Again, sighing and yawning, they help to regulate emotional distress. So we know that people sigh a lot and yawn a lot in different situations. So this is also important to understand that that overbreathing is most prevalent dysfunctional breathing behavior. So people have to sigh as a result quite a bit. We got 10 minutes. What we know about yawning, there's a lot of science and research out there. We know that yawning cools the brain. So it could, there are different ways we can do to help the client to stop yawning. I haven't done any of these in sessions with clients, but, depends on the situation. We know that overbreeding can reduce brain oxygenation by 30 to 40%. So you can actually even see it in the scans. We know that disruption in blood chemistry causes the overbreeding, and can, in more extreme cases, induce by hyperventilation. So this is also thing to kind of think about when you work with clients, because you can see that a lot. So you can see what happens during normal breathing, which you've seen in slides before. And again, humans typically sigh every 5 minutes to increase the brain oxygen delivery and activity. And it also helps to reduce, as a result of the physiology, the stress, emotional distress and anxiety. Now we know that, people who overbreathe, they also quite tense. And this is something you can see in terms of their vagal tone, loss of vagal tone, with sighs and yawns, that big amplitudes. What we can see here is shallow breathing with hyperventilation. So you can see the change in pattern. But again, you could probably observe this if you actually were looking at the client. And this is also people holding their breath. Often seen people who have apnea. So again, to summarize, with overbreathing, we have excessive yawning and gasping and sighing. We have drop in CO2 and pH increase. And we have drop in hemoglobin release of oxygen and nitric oxide, which reduces oxygen distribution. We have increased vasoconstriction and drop in oxygen and glucose perfusion. So this is a bit more sort of scientific way of looking at things. But I just wanted to come from different sides to tell you the importance of this and what does happen to the body. So breath is our tool to get into the autonomic nervous system regulation. So I know we only have a few minutes left, but I already mentioned that HRV can use in conjunction with different therapies. We have definitely used it with neurofeedback, different types of biofeedback like muscle, use it with the solution-focused therapies, cognitive behavior therapies, EMDR, people who sort of practice meditation, body activation, use it in group settings, use it with children, in work with trauma or tension. So there's all sorts of different applications of HRV where you can incorporate it into your therapeutic setting to suit you and your client needs. But really, I would encourage all of you to be as creative as you can and to share your experience and what you have found to be useful in this particular situation. It's great for pre and post, so it really can gauge how therapy works. Are we doing well? It's an objective measure that can tell us about autonomic, regulation of this client. So I think it's really good to help us with all sorts of things like that. It's a great tool for psychoeducation, as I mentioned earlier. It's fun, it's engaging. It takes away that sort of a sense of, being with the story or trauma or the pain. It takes you out of it and you can talk about different things. So there's all sorts of different ways that this can be used. We use it with neurofeedback quite often. I use it before neurofeedback, sometimes during neurofeedback. Client doesn't even know that, they have a sensor on, they're completely used to it. So, I can see how different protocols impact the client, and I can gauge it through HRV. I work with pain, fibromyalgia, and neurofeedback. So all sorts of different ways you can actually utilize HRV biofeedback in your work with clients. Again, they use it with music, so you can use it in conjunction with all sorts of different things. They use it, HRV, to assist musicians in performing better, sports people as well, and use it with aromatherapy, different types of body therapies, I guess. So really, it's again bringing that sort of science back to people, empowering them with it, giving them a sense of control over what's going on in their bodies and their system, that works equally good for children and for adults. It's really great to look what's going on underneath all of what's happening with them and give them a sense of satisfaction and grounding. There's a video which I included, which you can actually watch. There's a YouTube clip of a doctor talking about the heart, the smart heart. But I know that we are just about to finish, so I want to thank you for your time, and I want to apologize for having to deal with my coughing and everything. And I hope this was something that can set you up to be more bold and use this device. And if you don't have, you can go to Amphi webpage and you can purchase it from there. It's really important that you use it. The more you use it, the more comfortable you're going to be with it. And I would say the first person you should use it with is yourselves. You need to know how it works for you, how it feels. It's very important to feel comfortable with it yourself before you actually start telling and encouraging your client to actually do it. I would say that you use it for yourself for your own self-care. Working with clients can be very demanding. Working with trauma can be very demanding, or any sorts of situation can be quite difficult. So you really need to look after yourselves. And if you do have HRV, HeartMate or EMWay Pro, or any of the software available to you, I would really encourage you to use it every day. It's been scientifically proven that using HRV and having high coherence for around 5 minutes each day increases your ability to cope with adversity, to have better immune response. People get less sick. People are much more resilient to stress. They're much more satisfied with life. So I would thank you for this, and I would now ask if there's any questions. There's a reference list for reading. I'm just going to go to questionnaire and hope you're going to stay with us and check Amphi for more workshops. There's one with Seven Fisher. There's going to be one with Jay Gunkelman talking about brain and impact of coronavirus. I would strongly suggest you look into that. We're going to do neurofeedback training end of March, but we're also going to aim to have HRV training that's much more in-depth with practice possibility in-house for those who are interested to learn more, because we have trainings that are different levels. Some are more advanced, some are more basic. So I kind of try to mix a little bit of everything in this training. So if you're interested, for sure you can look into our website. Probably mid-year we'll provide in-house training that's heart rate variability training, and you can have a chance to practice yourself. We can take you through it, but I hope you stay safe, and I hope you are having a wonderful weekend. Thank you, everyone.